Now for next up, we'll talk about aortic stenosis in children. Okay, aortic stenosis. So aortic stenosis, if you look at this place, you're just trying to talk about what the aortic, valve. So aortic valve is what leads into the aorta. Of course, the aorta is on the left side. It's connected to the left side of the heart that handles oxygenated blood. So blood is oxygenated blood, that's blood that has a lot, so it's oxygen rich. It's supposed to flow through this aorta right into the body. So if you have a stenosis where the valve is kind of like becoming thick, it's becoming stiff, now you know that there's an issue of oxygenated blood reaching tissues in the body. Now you can start having a picture of how the complications will be like. So if it occurs in children, it can be congenital. That means they were just born like that, or it could be acquired, right, where the valve became narrow because of a whole lot of things. So in either one of it, just know that the valve becomes narrow, so it's kind of like restricting the flow of blood out, through the aorta to supply the various parts of the body. So the valve is normally very, very elastic. You understand? So in the stenosis, the valves are malformed. Sorry. Do you understand? So they are very hard for blood to pass through them. Do you understand? So the narrowing can occur below the valve, that's subvalvular. It could be valvular, or above the valve, that's supravalvular. Do you understand the thing? So causes congenital genetic syndrome, then acquired from infections. We have spoken about them. Okay, not here. Well, just so that infections like infective endocarditis can cause this. So symptoms depends on the age group. Of course, neonates should be much more vulnerable to this. Where you're having poor feeding, their skins are becoming bluish, that's cyanosis. Infants or children, they are just weak. They are dizzy, have chest pains and murmurs. Okay, so diagnosis: you are picking up that heart sounds, echocardiogram, electrocardiogram, cardiac catheterizations. You are doing all of them. So treatment options: if it is mild, just observe. Okay, or you can actually put what's kind of like a small balloon which is surgically put there to keep that space, patterns for blood to be able to flow through. The surgical repair or valve replacement, then basically the person should adjust their activities so that they don't get too stressed on the heart. Okay, so that's it for aortic stenosis in children.